Imagine this. You pop a pill for a headache or take something to help you sleep, fully trusting that it's safe because, after all, millions of people do the same thing every day. But what if I told you that some of the medications you rely on are ones your doctor would avoid at all costs? Shocking, right? Studies show that up to 66% of adults in the US use prescription drugs, and while these medications can offer relief, they often come with hidden long-term risks that most of us don't know about. For instance, did you know that prolonged use of certain painkillers can increase your risk of heart failure by 20%? Or that some cholesterol-lowering drugs may lead to muscle damage and even cognitive issues? Before we go any further, let's be clear. This isn't about blaming or undermining modern medicine. Medication is life-saving when used properly, but like anything powerful, it must be used with caution. Doctors know the long-term risks better than anyone, and they often avoid certain medications for themselves. So, what are these drugs, and why are they so risky? Let's dive into the medications that doctors are steering clear of, but that you might be taking without knowing. Why doctors avoid these medications. Before we dive into the specific medications, let's take a moment to understand why doctors might avoid certain prescriptions. They know the long-term risks associated with these drugs, risks that don't always come up during a routine checkup. While these medications can be life-saving in the short term, problems often arise when they're used over extended periods. Did you know that almost 50% of Americans are on at least one prescription drug? Many take these medications for years without fully realizing the potential downsides. Doctors, however, are aware of these risks and are often cautious about taking these drugs themselves. So, let's explore why they might say no to medications that millions of people use every day. The fine line between treatment and risk. Medication is undeniably powerful. It can manage pain, regulate chronic conditions, and even save lives. But here's the thing. Not every drug is designed for long-term use. While some medications can ease symptoms quickly, they often don't address the root cause of the problem. In fact, using them for too long might silently cause damage to other parts of your body. The real risk lies in the hidden side effects, things like heart issues, kidney damage, or even cognitive problems. This is why doctors are so cautious. They understand that quick fixes don't always lead to long-term health. For them, addressing the underlying issue is key, rather than relying on medications to mask symptoms indefinitely. 6 medications doctors avoid taking. 1. Painkillers, NSAIDs, non-steroidal anti-inflammatory drugs. Let's start with a medication nearly everyone has used, painkillers like ibuprofen and aspirin, known as NSAIDs. These are some of the most popular drugs worldwide, used to treat everything from headaches to joint pain. In fact, it's estimated that 30 million people around the globe use NSAIDs every day. They're so common that we barely think twice before popping a pill. But here's the catch. While they can provide quick relief, long-term use can come with serious consequences. Studies show that extended use of NSAIDs can increase the risk of heart problems by 20%, and gastrointestinal issues like ulcers or bleeding are even more common. In the US alone, approximately 100,000 hospitalizations each year are linked to NSAID-related gastrointestinal complications. That's not all. These medications can also affect your kidneys, leading to reduced kidney function and, in severe cases, kidney failure. What's the solution? First, avoid relying on NSAIDs for long-term pain management. If you find yourself reaching for these pills regularly, it might be time to look at the underlying issue. Physical therapy, lifestyle changes like improved posture, or alternative pain relief methods like acupuncture could be more sustainable options. And if you must use NSAIDs, always follow your doctor's advice regarding dosage and duration. Never assume that just because something is available over the counter, it's risk-free. Your doctor can help guide you towards safer, more long-term solutions for pain management that won't come back to harm you down the road. 2. Statins, cholesterol-lowering drugs. Next on the list are statins, commonly prescribed to lower cholesterol and reduce the risk of heart attacks. Statins, such as atorvastatin and simvastatin, are among the most prescribed drugs worldwide, with an estimated 200 million people taking them. These medications can reduce cholesterol levels by 30 to 50% and significantly lower the risk of cardiovascular events. Sounds great, right? But here's the reason why many doctors avoid them unless absolutely necessary: the long-term side effects. One of the most common issues with statins is muscle damage, which affects about 5 to 10% of patients. This can range from mild muscle pain to a more severe condition called rhabdomyolysis, where muscle tissue breaks down and releases harmful proteins into the bloodstream, potentially leading to kidney failure. Statins are also linked to an increased risk of type 2 diabetes. Research shows that statin users are about 12% more likely to develop diabetes, particularly in older adults and those with pre-existing risk factors. Another concern is cognitive decline. Some patients report memory issues or difficulty concentrating after prolonged use of statins, although this effect isn't fully understood and remains controversial in medical circles. These side effects, while not guaranteed, are significant enough that many doctors are hesitant to rely on statins as a first-line treatment for cholesterol management. For those with high cholesterol but without a history of heart disease, doctors often recommend lifestyle changes first, like adopting a healthier diet, exercising regularly, and managing stress. These measures can have a huge impact on cholesterol levels without the risks associated with statins. If statins are necessary, it's important to use them under careful medical supervision and regularly monitor for potential side effects. 3. Sleep medications, zolpidem, hypnotics. Struggling with insomnia? You're not alone. Millions of people turn to sleep medications like zolpidem, commonly sold as Ambien, for quick relief. Zolpidem belongs to a class of drugs known as hypnotics, designed to help people fall asleep faster. But here's the catch. While they can be effective in the short term, long-term use of sleep medications comes with a host of risks. One of the most concerning issues is dependency. Over time, your body may start to rely on the medication to fall asleep, making it harder to sleep naturally. This can lead to a vicious cycle where the more you take, the less effective the drug becomes, forcing you to increase the dose. Studies suggest that dependence can develop after just a few weeks of use. Another common side effect is memory problems. Zolpidem can interfere with your brain's ability to form new memories, which is why some users report sleepwalking, sleep eating, or even having conversations they don't remember. There's also the risk of daytime drowsiness, which can impair your ability to function, increasing the likelihood of accidents, especially while driving. Beyond that, zolpidem can worsen mental health issues like anxiety and depression, and its abrupt discontinuation can trigger rebound insomnia, making it even harder to sleep than before. So, what's the alternative? Doctors often recommend improving sleep hygiene and adopting behavioral changes instead of relying on medication. This means creating a consistent bedtime routine, avoiding caffeine and screens before bed, and keeping your bedroom quiet and comfortable. In more severe cases, cognitive behavioral therapy, CBT, for insomnia has been shown to be as effective, if not more, than sleep medications without the long-term risks. If you're already using sleep medications, it's important to talk to your doctor about a plan to safely reduce your dependency and explore healthier alternatives for long-term sleep improvement. 4. Diabetes medications, SGLT2 inhibitors. Now, let's dive into diabetes medications, specifically SGLT2 inhibitors, a class of drugs that help lower blood sugar by preventing the kidneys from reabsorbing glucose. Common brands include Jardiance, Farxiga, and Invokana. While these medications can be effective, especially for patients with type 2 diabetes, they come with a range of serious side effects that doctors often weigh carefully before prescribing them for long-term use. One of the most concerning risks is diabetic ketoacidosis, DK, a potentially life-threatening condition where the body produces high levels of blood acids called ketones. This can occur even if blood sugar levels aren't extremely high, which is unusual for DKA. Symptoms include nausea, vomiting, confusion, and difficulty breathing. If left untreated, it can lead to coma or death. SGLT2 inhibitors also increase the risk of urinary tract and genital infections, especially in women. Since the drug causes excess glucose to be excreted through the urine, it creates a perfect environment for bacterial growth. In more severe cases, this can lead to serious complications such as Fournier's gangrene, a rare but dangerous infection. Another common issue is dehydration. By promoting glucose loss through urine, these medications can lead to frequent urination, increasing the risk of dehydration and electrolyte imbalances. This can result in dizziness, fatigue, and in extreme cases, fainting or kidney damage. Doctors often prefer to manage type 2 diabetes with lifestyle changes, a healthy diet, regular exercise, and maintaining a healthy weight, before turning to medications like SGLT2 inhibitors. These changes can not only control blood sugar levels effectively, but also reduce the risk of complications without the serious side effects that come with long-term drug use. If SGLT2 inhibitors are necessary, patients should be closely monitored for any side effects and stay hydrated to minimize risks. 5. Proton pump inhibitors, PPIs, acid reducers. Proton pump inhibitors, PPIs, such as omeprazole, lansoprazole, and esomeprazole, are commonly prescribed to treat conditions like acid reflux, GERD, and stomach ulcers. These medications work by reducing the production of stomach acid, providing relief from painful symptoms. While they may seem like a harmless solution, long-term use of PPIs comes with significant risks that many people aren't aware of. One of the major concerns is nutrient deficiencies. Stomach acid plays an essential role in absorbing nutrients like magnesium, calcium, and vitamin B12. Over time, PPI use can lead to deficiencies in these vital nutrients, increasing the risk of osteoporosis and fractures. In fact, studies show that long-term PPI use is associated with a 44% higher risk of hip fractures. PPIs also alter the stomach's natural environment, which can lead to infections. Research has shown that prolonged PPI use increases the risk of Clostridium difficile C. diff infection, a severe bacterial infection that causes diarrhea and can be life-threatening, especially in older adults. Additionally, because of reduced acid levels, there's an increased risk of pneumonia, as harmful bacteria may not be properly neutralized in the stomach. Another long-term risk is kidney disease. Studies have linked extended PPI use to a higher risk of chronic kidney disease and even kidney failure, though the exact mechanisms aren't fully understood. So, what's the solution? Doctors often recommend addressing the root cause of acid reflux or ulcers through lifestyle changes. This includes weight management, dietary adjustments, like avoiding trigger foods such as caffeine and spicy dishes, and eating smaller meals. In many cases, simple lifestyle changes can provide significant relief without the risks associated with long-term PPI use. If PPIs are necessary, it's crucial to use the lowest effective dose for the shortest time possible, and consult your doctor regularly to reassess the need for continued use. 6. Antidepressants, SSRIs, selective serotonin reuptake inhibitors. Finally, let's talk about SSRIs, selective serotonin reuptake inhibitors, one of the most commonly prescribed medications for treating depression and anxiety. SSRIs like fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro, work by increasing serotonin levels in the brain, which can improve mood and reduce symptoms of depression. While these medications can be life-changing for many, long-term use comes with notable risks and side effects that you should be aware of. One of the most common side effects of SSRIs is weight gain. Studies show that up to 25% of people taking these medications may experience noticeable weight gain, which can lead to increased risks of health conditions like diabetes and heart disease. Another challenge many people face is a decrease in overall physical responsiveness and sensitivity. This affects a significant portion of SSRI users, with estimates ranging from 40 to 60%. These effects can impact one's sense of well-being and interpersonal connections, sometimes affecting relationships and day-to-day life. While these side effects can be frustrating, they are important to consider when evaluating long-term use of SSRIs with your healthcare provider. Perhaps more concerning for some is the potential for emotional blunting or numbness. While SSRIs are effective at reducing negative emotions, they can also dull positive feelings, leaving some patients feeling emotionally flat. This side effect can sometimes make patients feel disconnected from their experiences, a phenomenon known as SSRI-induced apathy. Another important consideration is the risk of withdrawal symptoms when discontinuing SSRIs, often referred to as antidepressant discontinuation syndrome. These symptoms can include dizziness, nausea, irritability, and even electric shock sensations. As a result, it's essential to taper off SSRIs under medical supervision rather than stopping abruptly. So, what's the alternative? Many doctors recommend combining SSRIs with cognitive behavioral therapy, CBT, mindfulness practices, or exercise, which have been proven effective in managing depression without the long-term risks of medication. These approaches can help address the root causes of depression while minimizing reliance on drugs, and in some cases, may even replace the need for medication altogether. Why lifestyle changes matter more than you think. You might be wondering, if doctors are cautious about these medications, what's the alternative? The answer is simple: lifestyle changes. Regular exercise, a balanced diet, stress management, and proper sleep can have profound effects on your health. Studies show that even modest changes, like walking 30 minutes a day or cutting back on processed foods, can significantly lower the risk of chronic diseases, improve mental health, and reduce the need for medications. For instance, research suggests that regular physical activity can lower the risk of heart disease by 35% and diabetes by 50%. These changes don't just reduce symptoms, they tackle the root cause of many health issues, leading to long-term benefits. Plus, a healthier lifestyle can boost your overall quality of life, giving you more energy and emotional well-being without the side effects of medications. In the end, understanding the medications you're taking and being aware of the potential risks can help you make more informed decisions about your health. Remember, never stop any prescribed medication without first consulting your doctor. But don't hesitate to ask questions and explore alternative options. Your health is in your hands, and you have the right to make the best choices for your well-being. Thanks for watching. If you found this video helpful, be sure to give it a thumbs up and subscribe for more valuable health tips. And don't forget, click on one of the videos that's appearing on your screen right now to dive even deeper into ways to improve your health naturally.